Hi everyone, good morning and good afternoon to all of you. Welcome to our Startup Creasphere APAC Batch 1 Expo. My name is Junhua and I will be your host for today. To briefly introduce myself, I'm the Senior Operations Manager for our FinTech, InsurTech and Health verticals here at Plug and Play APAC. And I also manage the Startup Creasphere APAC program here in Singapore. Following the success of our inaugural Batch 0 program last year, we're excited to bring to you Batch 1 for our Startup Creasphere APAC program today, and to present to you the 4 startups in this batch. For today's agenda, we will be starting off with an overview of Plug and Play and Startup Creasphere, followed by a keynote. We will then hear from our 4 startups who will be sharing with us more about their solutions. To kickstart the event, I would like to invite Kayvon Delda, Director of our FinTech, InsurTech and Health verticals here at Plug and Play APAC, to give an overview of Plug and Play and our Startup Creasphere platform. Kayvon, please.
Hello everyone, and welcome to our Batch 1 Startup Creasphere APAC Demo Day. My name is Kayvon Deldar, and I'm the Director for our InsurTech, FinTech, and HealthTech programs here in the APAC region for Plug and Play. For those of you that are unfamiliar, Startup Creasphere is a Crow-branded global accelerator program that was launched between Roche and Plug and Play. It was first launched in 2018 in our Munich office, and that program is currently on their 8th program so far. We expanded to create Startup Creasphere APAC in the middle of 2020, and this marks the conclusion of our 2nd program. We currently have 4 startups in our Batch 1 program, which are working with 3 of Roche's core business units: diagnostics, diabetes care, and the pharma team. Especially considering the advent of COVID-19 over the past 2 years, we see that there is an immense opportunity for both healthcare corporations and health tech startups alike, here in the Southeast Asia region, as well as globally. We look forward to scaling the Startup Creasphere APAC program with Roche and other like-minded corporations, and also the leading health tech startups in the region. We also hope to make our first health tech investment here in the region sometime in the near future. Thank you again for joining us for our Startup Creasphere APAC Demo Day, and we look forward to seeing you enjoy the startup pitches as well as our partner presentations.
Thank you, Kayvon, for the introduction. Next up, I would like to invite Debbie Su, Digital Innovation Manager at Roche Diagnostics Asia Pacific, to share more about Roche's vision for Startup Creasphere. Debbie, please.
Hello everyone, my name is Debbie. On behalf of Roche and the Startup Creasphere team, warm welcome to Expo 1, which is also the culmination of the 2021 APAC program. For those who don't know, Startup Creasphere is part of Roche's open innovation platform that aims to accelerate the development of digital solutions and new business models. Transforming healthcare together is our motto and also our vision. This means working with players in the ecosystem to jointly shape the digital future of healthcare. It also means working with startups to co-create innovative solutions to tackle complex disease challenges in the region. In a few minutes, you will hear from 4 very exciting startups and their pilot projects. Together, the Roche teams and startups have jointly explored a variety of focus topics, including fertility, diabetes care, and ophthalmology. We know that health tech has really flourished in the region in the past few years. Though the barriers of entry are becoming lower, the barriers of adoption and implementation of digital solutions are still very high. Therefore, I would like to congratulate the teams for their efforts in driving this change. Also, big thanks to both the Roche and Plug and Play teams for their contribution to the program. I look forward to the pitches and also the learnings gathered. Wishing you all a highly engaging session. Thank you.
Thank you, Debbie, for your sharing. Next up, I would like to introduce our keynote speaker, who is Dr. Lawrence Wee, Head of AI and Emerging Tech at the Ministry of Health in Singapore. He will be sharing more about the role of artificial intelligence in health innovation. Lawrence, over to you.
Greetings. Before I begin, I would like to thank the organizers, Plug and Play, for inviting me to share this topic virtually. The topic of AI is actually really close to my heart. I've spent a large part of my career working in this field in different capacities. Today, I'll be sharing on how healthcare innovation can be facilitated through the use of AI. But first, let me just bring everyone a step back to understand how we as a country sees the use of AI. Not everyone knows this, but there is a national AI strategy that was drafted sometime back in 2018. The national AI strategy was really grounded on a very specific yet simple mission statement, which is by 2030, Singapore will be a leader in developing and deploying scalable, impactful AI solutions in key sectors of high value and relevance to the citizens and businesses. The AI strategy outlines our plans to deepen the use of AI to transform our economy. And this is facilitated through 5 what we call ecosystem enablers. Firstly, there will be investments in triple helix partnerships between the research community, industry, and government. There will be investments in talent and education to address the need to develop homegrown talent. There will be investments in data architecture to enable quick and secure access to high-quality data sets across different sectors. We will set up progressive and trusted environments for test bedding, developing, and deploying AI solutions. And finally, we encourage international collaborations to drive and support sustainable development of AI with multinational researchers, businesses, and governments. Now, it's fair to say that our AI strategy for healthcare really takes reference from this national strategy. So now let me share just 2 examples that encapsulate some aspects of our AI strategy for healthcare. We have seen some significant applications of AI for diabetic retinopathy. Diabetic retinopathy, or DR, poses a problem, a large economic burden on the healthcare ecosystem, with nearly 1 in 10 diabetic patients developing vision-threatening DR. Early detection, accurate evaluation, and timely treatments of DR are effective in preventing blindness. However, the ability to implement this is limited by the manual nature of examining the patient's retinal images. This is especially a problem in Asia and in Singapore because of the rising incidence of diabetes and the absence of a tool for automated detection of DR. Over the last year or so, we have seen the deployment of an AI tool for diabetic retinopathy screening, and it's called Selena Plus, which is an acronym for Singapore Eye Lesion Analyzer. Selena's performance for detection of DR is quite comparable to our standard of care, which is manual grading by trained technicians. The use of that Selena Plus is expected to significantly enhance the productivity of our screening centers. There's actually many exciting future plans in place for the use of retinal images together with AI, and this includes analyzing the retinal images for possible risk of chronic kidney disease and cardiovascular disorders. The next example is around regulation. The Ministry of Health, the Health Sciences Authority, and IHIS has recently co-developed the MOH Artificial Intelligence in Healthcare Guidelines, which is a document that's available online. Now, the guidelines really aims to do 2 things. One is to share good practices with AI developers and AI implementers, and also to complement the Health Sciences Authority's regulations around AI medical devices. The AI for Healthcare guidelines are anchored onto the different phases of AI development and deployment, namely the design phase, the build phase, the implementation phase, and the monitoring phase. Now, in the design phase of AI, it is important for the AI designer to obtain inputs from the clinical and end user side. In the build phase, it's important for the developer to adopt risk and quality management standards and also put in place version controls for different iterative builds. And the implementation phase is important for users to know that they are interfacing with an AI system and there's some level of explainability. In the monitoring phase, it is important for AI models to be monitored for bias, adverse performance, and there should be protocols in place to handle adverse or abnormal predictions. In summary, I've mentioned about our AI strategy in healthcare and some examples of real-world implementation of AI and recent developments of AI governance. AI is an exciting area of work. So feel free to drop in some comments for collaboration. You can reach out to me over LinkedIn. I hope you guys have a great time today. Goodbye.
Thank you, Lawrence, for your insightful keynote. Moving on to our next segment, where we will have our program startups to share more about their solutions. The focus areas for this batch are women's fertility, ophthalmology, and diabetes. First up, we have Eva, which is headquartered in Switzerland. Eva is a digital women's health company which aims to advance women's reproductive health by bringing together artificial intelligence and clinical research. Please welcome Leah from Eva.
It's such a big pleasure to be here today. My name is Leah. I'm the CEO and founder of Eva. We're a company that really focuses on advancing women's healthcare. So we're one of the leading digital women's health companies focused on bringing AI solutions to all the big and hairy issues that still exist today within women's health. And the first issue that I want to talk to you about is fertility. Fertility continues to be a massive problem for really the entire world at the moment. Why is that? Well, fertility starts to be an issue for more and more couples. 1 in 8 couples today need fertility intervention in order to get pregnant. And it also costs the payer, whoever that is in that situation, a lot of money. The average pregnancy in the US today through IVF costs almost $70,000. Other countries are quickly following there. So it's a big issue. And the other problem around it is that there's still no preventative care for fertility available. We're only focusing on the problem space. We're not focusing on the prevention. And the big piece around prevention is timing. How can you improve getting pregnant naturally? It's by trying at the right time. There's only 6 days that a woman is fertile each cycle, and 75% of couples do not know when those 6 days are. So it's important that we help couples by finding out when the time is right to conceive. And again, just to put this into a larger perspective, fertility starts to be a major issue for payers and for governments, because governments want to support couples who want to have a child, but the costs are exploding all the way around. So we need to work on fertility. And the most important thing around it, as mentioned, is that we start focusing not only on the fertility treatment side itself, but on we call it preconception care, the time when a couple has a chance to conceive naturally. And for that, we have built the most advanced technology to support couples during that time. The Eva device and the Eva fertility device is the first and only CE-marked and FDA-cleared fertility tracking wearable. And it really helps couples conceive faster. So we're clinically proven to be 90% effective in detecting the fertile days. We also could show that Eva detects twice as many fertile days as LH urine tests. And we also know that almost 30% of subfertile women get pregnant using Eva naturally instead of having to go into treatments. So we've basically taken the power of AI and the power of wearables and built the most sophisticated tool to support couples in getting pregnant. So how does that tool look like? It has different components and it's an entire ecosystem. The most visible part of our solution is a wearable device that is worn only during the night. That wearable device picks up almost 1 million data points per night: perfusion, breathing rate, skin temperature, heart rate variability ratio, and resting pulse rate. So we're measuring all of those data points every night, and then it goes into the least visible but the most powerful part of our solution, which is our big data and AI backend. So we have multiple algorithms then running through that data every day, and then giving our users the output on their phone conveniently, telling them, are they fertile today or are they not fertile? We've also just presented at ASRM that Eva is as accurate as LH urine tests in detecting ovulation, but we're detecting more fertile days in per cycle. This is really groundbreaking, and I want to emphasize this for a second. This is the first time that digital biomarkers, as we like to call ourselves, are outperforming actual biomarkers that come out of urine. As I mentioned at the very beginning, we care about AI in all different aspects of women's health: fertility, pregnancy, and also in contraception, which we're launching a product in soon. And again, in all of those areas, we want a holistic journey for women. We want to empower women with the data they need at the right time, be it digital biomarkers, or be it also biomarkers that they're getting from urine, blood, or any other sources that they need testing for. Because in the end, we want to stop having couples run around from one place to another. And that's our vision of building, and that's in our vision is to create a really strong platform and data set to enable that journey. That is, I think, what allows us to really improve lives here. And again, fertility remains a major issue and will become much more of an issue over the next couple of years. So we need to bring the best and brightest of the industry together to build joint solutions and to build the perfect preconception journey for couples. And I'm excited that we had the chance so far to work on that and continue to develop that further. Thank you very much.
Thank you, Leah. Next up, we have Telemedicine from Singapore. Telemedicine is a diagnostic imaging solutions company that uses sophisticated eye imaging, and their primary objective is to provide low-cost diagnostic solutions for the screening and management of eye and chronic diseases. Please welcome Cheryl from Telemedicine.
Hello everyone, my name is Cheryl, the Marketing Manager of Telemedicine. We are a diagnostic imaging solutions company that uses sophisticated eye imaging techniques to provide affordable eye screening services to people all around the world. Globally, more than 1 billion people suffer from poor vision due to delayed detection of eye conditions. And within the diabetic population, studies have shown that 80% of them will eventually develop diabetic retinopathy, resulting in blindness. However, early detection and treatment are of vital importance at preventing such vision losses. Since 2014, we have been developing our AI software using deep learning and machine learning methods. It is currently available in countries like Singapore, Malaysia, Australia, and soon in Germany. A quick drag and drop of the retinal eye images onto our digital platform will return results that identify the presence and severity of different eye diseases. We also build hardware that captures images of the anterior and posterior segments of the eye that is embedded with our offline AI modules. There are existing solutions available, but they do come with certain limitations such as being unable to grade the severity of the eye condition using their AI models, and even the challenge of usability and slow processing speeds. For our product infrastructure, retinal images are processed on the cloud within minutes, and we also offer digital platforms for clinical users and patients. In this day and age, it is vital to build a virtual bridge between patients and healthcare professionals for easier communication. At Telemedicine, our AI services has gone beyond the proof of concept stage, and we have obtained regulatory certifications and are fully commercialized. When the retinal images reaches the cloud, its quality is assured by our deep learning model. We also have risk prediction models that detect both early and sight-threatening diabetic retinopathy. Currently, our AI diagnostic services can detect eye diseases such as diabetic retinopathy, glaucoma, and age-related macular degeneration. All of them come in two versions, the light version that returns a yes or no condition, and the full version that checks for the severity of the disease. And in addition, the CD ratio model also gives a cup-to-disc ratio measurement. And now, introducing the Rabbit, a fully automated multifunctional device that captures images of both the anterior and posterior eye. It's packed with really cool features such as embedded offline AI modules and work without an internet connection in remote locations. And its uniqueness goes beyond the sleek design as it is light and very portable. Next, we have the TeleEye MD web application built for general practitioners, ophthalmologists, and optometrists. This is a patient management platform that comes with a statistical dashboard for patient data analysis and risk prediction services to better manage the patient's health. It also includes scheduling and teleconferencing features for further eye grading and teleconsultations. Lastly, we have the TeleEye MD mobile app that is available in both the App Store and Google Play Store. and this is the patient-facing app for those who care about their own health. Within the mobile app, users can scan QR codes at their nearest eye screening locations, get full access to their eye exams, reports, and even manage their own data. It also provides nutritional and educational information for them to have better understanding of their own health. Telemedicine is constantly open to collaborate with professionals within the health and eye care industry, businesses that require any sort of eye image grading, and fundus camera providers to work together and deploy cameras to multiple locations such as optical stores and pharmacies. Lastly, we also work closely with GP clinics and hospitals. We look forward to partnering with innovators and startups in participating in our mission to save eyes and improve lives. For more information, please visit us at www.telemedicine.com. Thank you.
Thank you, Cheryl. Next, we have Fitterfly, which is headquartered in India. Fitterfly is a digital therapeutics company which uses personalized technology to help those with diabetes, obesity, and other conditions to achieve their health goals. Please welcome Arbinder from Fitterfly.
Hello everyone, my name is Arbinder Singhal and I'm the co-founder and CEO of Fitterfly HealthTech Private Limited, a digital therapeutics company based out of India. We are helping thousands of people achieve better health outcomes for chronic health conditions. And today I will be sharing with you how we do achieve those outcomes. So our company is based out of Mumbai. We are a team of more than 150 people where we believe a 360-degree guidance to help people, especially starting with diabetes, can make a lot of difference to their lives. In India, chronic healthcare diseases account for almost 70% of the healthcare spends, and this is true worldwide as well. But if you look at the health system per se, there are a lot of gaps between what the patients actually need and what the healthcare system currently offers. Hence, our mission and vision is to give every human being a way to understand and reset their health operating system to achieve better health and also to prevent, reverse, and manage chronic diseases. And the pathway to build this system is by doing digital therapeutics, which is a subset of digital health, promising better health outcomes. In the last 5 years, we have done a lot of technology as well as clinical work to establish a working product. We have achieved clinical validation by publishing our papers and research and presenting our work at a lot of international conferences. We have proof of early adoption in terms of patients paying for our programs and achieving those outcomes. But most importantly, our startup is known by the team which the startup has. And we have been able to create a winning team and a strategy which will help us scale up, define, and own the category of diabetes disease management in India and hopefully in GCC and Southeast Asia as well. Now, how does our product work? Our flagship diabetes management product is known as Diabefly Digital Therapeutics Program. The aim of the program is to prevent, reverse, and manage diabetes. There's a lot of data which flows from devices like continuous glucose monitoring devices or glucometers into our system, which helps us understand the blood sugar variations and then plan appropriate therapy. So Diabefly therapy in nutshell consists of personalized therapy, which is diet plans, mental well-being plan, fitness plans, personalized coaching by a nutritionist who's the primary coach, by a psychologist, and by a physiotherapist, and a lot of digital interventions, which are nudges in 2 to 3 nudges per day, educational modules. We have created a huge amount of personalized video content for these patients, and we will be starting with group therapy also very soon. As a consequence of this 360-degree approach, understanding various aspects of diabetes, we have achieved best-in-class outcomes in India, where 92% of our patients have shown a significant drop in HbA1c measuring up to 1.22 points. 85% of the patients have lost weight, and 30% could actually reduce their medication significantly. And this data has been presented at various international conferences. These are the abstracts which one of the abstracts was recently published in Journal of Endocrine Society. We have 3 abstracts in the IDF virtual conference this year, talking about personalized glycemic response, effectiveness of our platform, as well as diabetes-related distress. We believe we can help a lot of people. If you look at just diabetes, there are 170 million people with diabetes or pre-diabetes. Obesity affects 135 million people, and hypertension, heart disease, another 250 million people. This is all within India, and globally the scale is even bigger. All these people can strongly benefit from our digital therapeutics programs like our programs. Within India, we are focusing heavily on people with pre-diabetes, new onset diabetes, people whose glucose control is not good even with multiple prescriptions, people who are starting insulin, and people having diabetes and obesity. We believe that we will be a pioneer in the field of diabetes management in India, Southeast Asia, and GCC, and we would definitely succeed. We have achieved a strong clinical validation, established sustainable channels of growth, put in the right teams in place, and most importantly, this is a doctor-led company, so we understand what healthcare means. And we believe all this put together will lead to a very category-defining approach, making us into a unicorn. We believe this is the age of personalized technology. A new era is beginning, and whether we will build rockets for exploring space or self-driving cars, but the real calling of technology will always be for alleviating human suffering, and that is wellness. Thank you very much.
Thank you, Arbinder. Next up, we have Gemini, which is based in China. Gemini is a private domain expert in the enterprise WeChat ecosystem and provides AI and software as a service enterprise products and solutions. Please welcome Kevin from Gemini.
Hello everyone, this is Kevin, the founder and the CEO of Gemini Technology. I'm very glad to be here today to present our company, what kind of problem we are solving, and why we are here. In 2016, China has launched its planning called Healthy China 2030. Since then, we have seen tremendous improvement in the market, but yet there's a lot of challenges to conquer. The disease occurrence rate is still high. In 2020, we see over 330 million cardiovascular patients, almost 120 diabetes patients, and in just 2020 single year, there are over 1.5 million newly cancer patients. While we see the in-hospital care is still under demand, we see a big problem in out-of-hospital patient care. It may come from a lot of reasons. The commercial insurance industry is still under development, so the payers are very limited. The current approach is like traditional and passive follow-up. You receive calls, you receive short messages, but you don't have a lot of interactive environment to provide the necessary care the patient needs. So we come up with a problem. Is there any better way to provide out-of-hospital digital care to the patients and provide truly interactive, personalized, and low-cost solutions to the patients and protect their health? This is why Gemini exists. We're relentlessly thinking of using the high advanced technology to provide digital care to the users and patients in China by utilizing the advantages coming from the social network like WeChat and smart diseases like the smart glucose meters. Gemini was founded in 2016. We start our business from caring mom and infants by working with China Mom and Infant Care Department and covering 4,000 hospitals to provide the maternal care to over 3 million newly moms in a single year. Over the past 5 years, we gradually developed our business covering 3 key sectors, including maternal health, consumer health, and medical. We have successfully collaborated with over 100 leading brands in China, We have served over 20 million healthy users, over 1.5 million patients, and work collaboratively with over 500 projects to protect the patient's health. Jimmy has two very unique advantages in the market. Number one, we fully utilize the social network advantages, like WeChat. Well, think of that. WeChat has now over 1.2 billion monthly active users. It can provide a very efficient way of providing digital care. We have also developed our technology to smart connect the devices, including the diabetes meters, the COPD devices, etc. Besides that, we're not just providing the products and tools. We have put a lot of efforts in developing a highly effective patient care operation systems. So we roll our sleeves, we provide our full-time caregivers, work with doctors as their assistants to provide AI-based but human-mixed care systems to the patients and the users they need. By now, Jimmy has over 400 full-time employees, in which over 100 of our product and technology team. We have over 200 full-time caring staffs. And then we continue building the industry benchmark and best practices in different sectors, like skincare, like maternal, like cardiovascular, and now we are also aiming the diabetes and the cancer sectors. I would like to introduce our product, Gym Care, to everyone today. Gym Care is a WeChat-based smart patient community and disease management products. We provide AI-based patient one-on-one care assistant, the WeChat group, to the patients join and discuss their disease progress, their care, their needs, and necessary help in it. We have developed the online education platforms, the key opinion leader systems, as well as online internet hospitals. That way, the doctors the patient meets offline can come online and provide the necessary care to the patients, timely and flexibly. The doctors can join with our full-time staff to provide a comprehensive care system to the patients. They are not working alone. We also leverage the active patients, the key opinion leaders, the doctor assistants. We are really focusing our efforts to solving one problem, to provide a timely feedback and care whenever the patients have their glucose measuring. Okay, that's all. Thank you very much for today.
Thank you to all of our speakers and startups for their presentations. If you would like to find out more about our Startup Creasphere APAC program, or to find out more about any of our startups, please feel free to reach out to us and we'll be happy to assist you. Until then, take care and have a great day ahead.